I was going to pitch to Penny first, I think, on this one.
Okay,
I
great.
think that'd be great. Thank you.
Okay, and then I've got us at 1:15 straight up, so we'll go ahead and get going. Welcome everybody to our now bi-weekly gathering of about everything regarding the COVID pandemic at Indiana University, the city of Bloomington, Monroe County, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University, and as we just indicated, we'll have a significant announcement from Monroe County Department of Health. Let's first go to Penny Caudle.
I almost forgot how to unmute my microphone there. Thanks, Chuck. I appreciate it. Thanks for everybody joining us today. What a difference a few weeks makes. You know, 2 weeks ago on July 16th, Monroe County was still in a blue advisory. We had 39 cases per 100,000 and a positivity rate that was still under 5%. It was close, but it was still under 5%. And while we were talking about cases rising and concerns about the Delta variant circulating, we were reminding folks about action steps. We still had some positive things going on. 72 Indiana counties were in blue. We had 56% of our eligible population fully vaccinated. And then here we are today, 2 weeks later. We are back in a yellow advisory with 58 cases per 100,000 and a positivity rate of 6.91% this week on that metrics map. Only 37 Indiana counties are currently in blue. 56.7% of our eligible population is now fully vaccinated. That's 0.7% increase in 2 weeks. One of the least vaccinated groups who are eligible are the 12 to 19-year-olds, and school is starting. This week, the CDC revised guidance based on new data, the rising number of cases, the Delta variant being prominent and easier to pass to others. The new guidance recommends masks when indoors, regardless of vaccination status, when community transmission is elevated, and they're specific to substantial or high elevations. They consider 51 cases per 100,000 or higher to be substantial. So here we are. We have less than 60% of our eligible population fully vaccinated. The virus is spreading among all ages, and we have a large number of the community still susceptible because they are unvaccinated. Some because they're not eligible yet, some because they have chosen not to be vaccinated for whatever reason. When we removed the health regulations earlier this summer, vaccinations were rising, cases were dropping, and we fully expected that to continue. Unfortunately, it has not. The health officer is therefore issuing a new health order, which will go to the Board of Health as a regulation on Tuesday, and then must be approved by the Board of Commissioners prior to it taking effect. We expect this to occur next Wednesday. The health order and regulation will require masks in indoor public places, regardless of vaccination status, while we continue to have higher transmission. It again notes that schools should follow CDC, Indiana Department of Health, and Indiana Department of Education guidance. At this time, that means masks should be worn in schools. As I look back at the numbers over the past week, I have no doubt that we will again be in yellow next week, and probably not far from orange without this action. I expect it will take several weeks and everyone following recommendations and following regulations in order to get out of this and to do it quickly. So we ask that you mask up when indoors in public places, continue to practice distancing, washing hands, covering your coughs, all of those prevention strategies that we've talked about. Stay home when you are sick and get tested even if you are vaccinated. Please review the CDC guidance for your situation. It is different whether or not you're vaccinated or not. So please review that guidance and apply it appropriately. Get your questions answered about vaccine. If you've been holding off on being vaccinated, Now's the time to ask those questions of your healthcare provider or other trusted source. Get vaccinated if you are not, and help others get vaccinated when you can. Vaccine is available, it's free, it's safe, and it's effective. A small number of breakthrough cases does occur, but they work in those situations. And by they, I mean the vaccine works in those situations by lessening the severity in most cases. Something that has not changed is that this pandemic is not over, and we must work together to overcome it. Remember, we, not me. Let's end this by doing all that we can to stop the transmission of COVID-19. Back to you, Chuck.
Okay, thanks very much, Penny. Let's then go to Mayor John Hamilton for the city of Bloomington.
Thank you very much, Penny Caudill, for that very important announcement, and for all the media here. I have to say, it's like Groundhog Day, the movie. Here we go again, except that was a comedy, and this is a tragedy. As Ms. Caudill said, most of Indiana counties are again yellow or orange, including our own. We are facing rising cases, the need to modify our behaviors to protect public health. And again, thank you, Health Department and Penny Caudill, for leadership on that. I think when the history of this pandemic is written someday, there will be many heroic figures, there will be dramatic science, and there will be everyday workers who've done extraordinary things consistently. But there are also far too much incredibly misguided leadership and tragically short-sighted actions by tens of millions of people. We are regressing. People are dying in our state and our country because not enough of us are getting vaccinated, which is very safe, highly effective, as Ms. Caudill just said. We have let the virus mutate and come at us again. The virus is the enemy here, and we have to come together to vanquish it. We know how, we have the tools, but we apparently do not yet have the collective civic will to do so. That is a tragedy. We have to continue to emphasize facts and reality and hope that more and better decisions will happen. I will report this week that we've had 549 city employees have now filed for their vaccination reimbursements. That's about a 5% increase in the last month. We are looking at new incentives and protocols as an employer. We have no new city cases this week. I'm glad to report that. And also report, as I do periodically, that the City of Bloomington Utilities continues its virus detection monitoring. We have had no detection level. That means it's less than 10 gene copies per 100 milliliters, no detectable levels for 6 weeks until this week. We did have a detection of 12 gene copies per 100 milliliters at the Dillman plant. We're going to continue to monitor that, and we'll also look at increasing the frequency. I will note, actually, just as a side note, the State Board of Health is sharing with the CDC all this data from utility monitoring that has been done since July of last year, just to help them have data too. I want to again just express appreciation for this group and the cooperation and collaboration that we have for Indiana University and IU Health and your steps, and the recent Monroe County Consolidated School Corporation steps that they've taken to protect our folks, and for the leadership of the County Health Department. I believe you're doing the right thing. I appreciate that about masks and following CDC guideline. We have to follow the science. It's hard to watch this when we know we can get out of this, and we'll look forward to continuing to hear about steps we can take. And I'll just add my voice to urge all of us to continue to get vaccinated to protect against these mutations of the virus, so that we don't have to go through this again. The stakes are very high. Thanks.
All right, thank you, Mr. Mayor. Let's next go back to the county and Julie Thomas.
Great, thank you, Chuck, and thank you everyone for being here today and for everything everyone is doing for our community to protect us. First, to note that our Township Assistance Fund was regenerated, and it is available as long as there is a governor's order. So we know at least now through the end of August. That fund is available through our township trustees, and it is available to folks who are struggling to pay for basic necessities like shelter, food, healthcare, whatever it might be. So please contact your trustee if you are in need. Every county resident, whether they live in the city, the town, or outside of those entities, every county resident lives in a township, and you can find that list of township trustees and their contact information at co.monroe.in.us on the emergency management page. Also, a note that on next Friday, August 6th, the Hoosier Hills Food Bank will continue its Fresh Friday food distribution work from 10 a.m. to 2 p.m. And an important note there, from 10 a.m. to noon, our great health department has organized a vaccination clinic. So if you're coming by to pick up food, or even if you're not, you're welcome to come to 2333 West Industrial Drive. It will be the Johnson & Johnson one-shot vaccine, and it's available for anyone over the age of 18. No appointment necessary. So if you've been putting it off, now is your chance. So we hope to see you folks there. The Board of Commissioners will be there as we usually are. Our employees are going to be asked as of Monday to begin wearing masks inside county buildings. We ask that until we have a ratified health order that the public does the same. I want to thank all the folks who have been vaccinated. We appreciate you. And unfortunately, because of the unvaccinated, whether by choice or by age category or health condition, our community, our children, the immunocompromised, and our businesses are at risk again. And please, please talk to your friends and neighbors, encourage them to get vaccinated, encourage them to contact a health professional if they have questions rather than using social media. But thank you all for all you do, and we will take questions at the end. Thanks.
Okay, so next go to IU Health and Brian Shockney.
Good afternoon, everyone, and thank you so much for joining us today. We continue to see our COVID-19 infections across IU Health South Central climb over the past week. The numbers in Monroe County between the IU Health Bloomington and Monroe Hospital are showing this same trend. With 2,720 breakthrough cases in Indiana, unvaccinated populations still account for 99% of COVID cases, which is the same trend we're seeing in our hospitals. Across the state of Indiana to date, only 132 fully vaccinated people have been hospitalized, which is 0.005% of fully vaccinated people. The Indiana State Department of Health is also reporting that 91% of samples tested this month have been the Delta variant, which has been mentioned before. This is another reason why our community should be getting their vaccine if they are able to, and should be wearing their masks when out in public or in places where you are vulnerable. We are appreciative of the past and continued leadership and decision-making to protect our community by the Monroe County Health Department, City of Bloomington, Monroe County Commissioners, Indiana University, and others who make difficult decisions on our behalf, which is their responsibility and their position. As the first IU Health system to require the C-19 vaccine for those who are caring for patients, IU Health has remained aligned with these protective measures with our continued mask requirements since the start of the pandemic in all care spaces and in all of our buildings. IU Health has required masks in our hospitals and patient care areas since early on in the pandemic, so this announcement does not change anything. It just further reinforces the need for team members, patients, or others entering any of our hospitals or clinics to be masked. As someone who has worked in a patient-facing capacity, now as a leader of many of those frontline caregivers, this return to mask wearing is positive due to the increased danger of Delta variant has brought to our community. However, it is also a burden to wear a mask when you're continually caring for patients at work. Until we can continue to increase our vaccination rates as a community, this is a critical step in once again containing this pandemic and saving lives. Our hospital experienced a lot in the past year and a half, and while we are prepared if a surge of patients increases, no one wants that. We want our community to be healthy and happy and continuing their day-to-day lives. In my opinion, adding a mask to your normal routine at this point in time is a very small price to pay. I'm happy to take questions at the end.
Okay. Next, check in with Kirk White and Indiana University. Before we do, just right off the top, we'll say that the IU mask policy at the moment has not adjusted. We've just received this information today, along with everybody else. We'll continue to review and work, of course, with the county as the public health situation evolves. Otherwise, Kirk, over to you.
Well, thanks, Chuck, and appreciate the lead in there. And yeah, the university, as we've done through this whole process in the last year and a half, has continued to keep our organizational structures in place so that we can study what's going on and make those adjustments. And in our case, of course, we're monitoring the entire state, but for the Bloomington campus, it's important to note that where Monroe County's number is, as Director Cottle mentioned earlier, 57% vaccinated. We're at about an 85% rate on campus, and so this makes us feel like we're in a pretty good risk position because of the high compliance rate that we've had with people actually vaccinated. Of course, we still have the medical and religious and ethical exemptions that are being filed and reviewed. But of course, those folks that have exemptions will be in our COVID check mitigation testing pool. So we feel pretty good about where we are at this stage in the game. But what we'll do is continue what we've done all along, and that is continue to work with our medical experts through the IU School of Medicine and taking leads from the various agencies, CDC and our State Department of Health and local health department as well. And that's how we'll continue to make decisions. But as Chuck mentioned, we're in that study stage right now, and feel like we're in a pretty good spot because of it's honestly as of today, it's safer to be on campus than it is not on campus because of the disparity, 30 points of disparity between vaccination rates. So again, this just shows the importance of getting vaccinated. Our goal, of course, is to continue to be the safest place to be, and having the health and safety of our students, faculty, and staff has been our guiding beacon through this entire pandemic emergency. I would note very clearly, though, that we've continued a masking policy that's still in effect and will be for several different types of activities on campus, and those are at our testing sites, our vaccination clinics, our quarantine and isolation housing facilities, our child care facilities, public transportation, so our bus system, and our, of course, our symptomatic testing sites. So all of those places still require masking and will this fall. And in addition, as I transfer over my next point as we get ready for fall, it is a requirement for those visitors on campus that are doing move-in to our residence halls or other congregant living environments that they be masked because we don't always know their vaccination status. And again, this is a good way to mitigate spread. So those who are planning to come to campus to help with move-in should sure bring a mask along because that is a requirement for the campus. Now, our fall restart schedule is starting. Now we'll have some students and staff, particularly in our residence hall system, will start arriving next week. International students will start arriving on the 7th, and our normal residence halls move-in begins on the 15th. And I just might put in a side comment there that August 15th will be a very big move-in day with the largest freshman class we've ever experienced. Though we're trying to spread out move-in through the week and assigning people times, Sunday's always very popular because people are off work. That would be a day to kind of not be driving around the campus because it's going to be very busy on the 15th. So I'd warn you ahead of time about that. Other than that, our restart plans are on track and doing well, and look forward to giving you further updates about that and answering any questions today. Thank you.
Time to watch the one-way streets. So
Right.
let's go into our questions. First of all, from Dave Askins, the B Square Beacon, question for Penny Caudle. How will the planned renewed mask requirement apply in the context of restaurants? If it's the same as it was when we had a mask requirement previously, could you remind us of how that works? If it will not be the case that people eating in indoor establishments have to wear a mask between bites, correct?
All right, Dave, not between bites, but yes, it will pretty much be the same as it was before. So any public place that would include a retail food establishment, then you would need to wear a mask. So when you're entering, exiting, if you're up and moving around, whether it's going to the restroom or whether you're talking to someone else, if you are actively eating or drinking at your table, then you will be able to remove your mask. And at this point, this is really the only requirement. It's about masks. It's following the CDC guidance to ensure that everybody who vaccinated or not is wearing a mask when they're indoors. So that's what prompted this. That's all we have at this point. And we will continue to follow the numbers and make other decisions. Hopefully everybody will kind of get on board and do everything that they can so that we can stop this transmission and get our numbers down quickly.
Another question from Dave Askins for Julie Thomas. Is the security company that was under contract to help with enforcement still under contract for that? And is there any thought in consideration of that?
That's a great question, and their contract ended, but the good news is, if there's any good news in this, is that the health board is meeting on Tuesday. The commissioners meet Wednesday morning. So if the health board wants us to renegotiate a contract, another contract or a contract extension, that it would be an opportune moment to do so. So I will be at the health board meeting, and I will be, of course, there on Wednesday morning. So whatever we can do, I know that my colleagues and I on the board are doing all we can to try to protect Monroe County residents, and that would just be one step.
Okay. Question from Dave Askins for Kirk White. Monroe County Community Schools planning to use prize drawings as incentives for students to get vaccinated. And the city of Bloomington looks like it will probably be providing $30,000 in CARES Act funding to do that. Based on its own experience, does IU have some data that it might be able to share publicly about the effectiveness of prize drawings as incentives in convincing people to get vaccinated who would not otherwise do so?
That's a good question. Our prize drawing that we had really was layered into a whole communications campaigns. It's kind of hard to tell the effectiveness of just that by itself, because at the same time we were doing text messaging, we were doing emails, and then of course the last couple of weeks we've been calling people directly to talk to them about their vaccination status and give them the tools to get vaccinated or send us their documentation. So Dave, it's hard for me to split that out. What I will tell you is that when we decided to do that, we knew that it would build some excitement on social media networks. There's always the added benefit of having a contest, and people like to win contests and really meet people where they are in this whole continuum of decision making. maybe it caused a few people to think about getting educated about the vaccine and showing up at one of the sites because they thought, well, hey, I could use free tuition for a year. And so we think that it did work because we did see increased interest during that time. But as I say, it was in addition to a lot of other things we're doing at the same time.
Yeah, and I would add to that, Kirk, of course, remember that we were starting from a baseline of requiring the vaccine already. We were really encouraging the uploading of the confirmation as the prize, getting into that prize. So a little different situation in that regard.
Right.
Question from Ethan Burks, WTIU for Penny or Brian. What percentage of hospitalized COVID patients are vaccinated? Brian, you want to take that on first?
Sure. Yes, it's the same as we're seeing across the state. Only 132 fully vaccinated people have been hospitalized in Indiana. And again, that's 0.005%. That's 0.005 of 1% of fully vaccinated people are being hospitalized, not even close to 0.5%.
Question from Ethan for Mayor Hamilton. I'm aware, well, it says, I don't know if I want to go on this. This may be something for offline. We've pretty strictly tried to keep this as a COVID related matter, but having to do with another incident in town. So I'm going to keep that rule in place here. But I'll send that on to the mayor, Ethan, so that maybe it can be answered another way. So Brian, I'll wait for other questions to come in if there are some, but I will ask this in relation to what you just said. And this was a question we had our Ask Aaron webinar for IU this week. And I asked Aaron this question, which was, there's a lot of talk that you read, particularly in the case of IU, where we had a significant publicized breakthrough case. I'll put it that way. You hear about the breakthrough cases, but as you noted, the hospitalization rate is almost non-existent for those who have been vaccinated. And the chatter online, and I realize the hazard of looking at chatter online, but is that, well, these vaccines don't even actually work if we're having all these breakthrough cases. In actuality, that percentage points to the fact that it does work, does it not?
It does. I think we probably each could say we know someone who, even distant from us, that had a breakthrough case. As the mayor said, we follow the science, and others have said before. And I personally know of someone in my family who had a breakthrough case. They had a few days of feeling rough, but that third day, things just took off like crazy, and they felt better and were back on their feet again quickly. And their symptoms, while they felt really bad for a few days, that wasn't even close to needing to go to medical help. So I just want to be sure people understand that this vaccine does work, and the science shows that the vaccines work, and it prevents hospitalization, and it prevents severe sickness, and it also prevents death.
Chuck, if I might add, and just kind of to go a step further with what Brian was talking about, the vaccines work. We see breakthrough cases with all vaccines. Nothing is 100% effective, but we get vaccinated not only to prevent infection, but to prevent those hospitalizations and the severe disease and the death. And the State Department of Health issued kind of the odds of being hospitalized if you are infected with COVID. If you were vaccinated, the odds are 1 in 18,795. And if you're unvaccinated, 1 in 237. So if you're concerned about, kind of the outcome of this, sometimes people say they're concerned about the side effects of the vaccine. The side effects and the severity of disease that people can experience with COVID, with the actual infection, is much greater than anything from the vaccine.
That is for sure. Question from Dave Askins for Kirk White. You mentioned that IU has been calling people on the phone about their vaccine status. That seems like it would take a delicate touch. It's the kind of call that a lot of people would not enjoy making. Have people been drafted to do that outreach, and who's been making those calls?
Well, thanks, Dave. A good question. That really gets to the heart of a lot of our discussion is, the emotional toll this has taken on our communities, the concern about getting infected, and then the questions about what to do if I am, even the questions about whether I should be vaccinated. They're all emotional questions that take time for people to sort through. In our case, I think everybody knows that last year we built a team of contact tracers that we felt was necessary for the university to have. So the contact tracing team were people that we, again, a team that we hired and built and trained to call people that had been close contacts of infected people infected with COVID, so that we could get those people into quarantine situations. So they would call the infected person, find out really very difficult questions. Who have you been in contact with for the last 48 to 72 hours for more than 15 minutes, unmasked, indoors, outdoors, all those things. So when our infection rates dropped to such low levels, we still had the team in place. So we asked our contact tracing team that had been really trained to make these difficult type of calls to start running through the list of our students, faculty, and staff that we had not heard from in their vaccination status. So it was a pretty good fit.
Okay. And again, Kirk, I can't remember if you mentioned this percentage earlier or not. I think you did, but we're approaching 85% across IU, not just IU Bloomington, but across IU, of those who have at least had the first dose of the vaccine, which is an excellent number that we intend to build on. So that's where we hope to go as close to 100% as we can. Won't get to 100%, but we'll get pretty darn close, we think.
Yeah, we wanted people to get their at least their first shot in by July the 1st. That's why that was our first big push, so that they get second in and then be fully in effect by the time they arrived on campus. But if not, we will be having, of course, vaccines available upon arrival for those who lived in communities or countries where it was not as easily available, or if they decided on their way that, hey, now's the time. We'll have plenty of free vaccine available as people are arriving on campus.
Okay, we'll take just a moment here. If there is another question or two, be happy to take that. Otherwise, we are scheduled to come back in 2 weeks as we continue our biweekly. I said this wrong last time. I was trying to make my bad joke about this, that I didn't understand if biweekly meant twice a month or every 2 weeks, and I still haven't quite figured it out. But so we'll just say we're going to be back in two weeks at this point. So whichever way you want to refer to it or think about it, we'll be fine. So seeing no other questions, we'll leave it there, and we will see you in our next every 2 week session here for another update on the county, the city, IU, and IU Health. Thanks, everybody.